New at 5:30, there are just 3 weeks to go until thousands of people across the state can start enrolling for health insurance under the Affordable Care Act. Tonight, we get an exclusive look inside the brand new call center where operators will help people sign up. NBC Connecticut's Jeff Saperstone is live in Hartford with the details. Jeff's going to be a busy place soon.
And Jeff, it certainly will be. That call center tucked inside an office building here in downtown Hartford. And today we got a look inside at who will be on the other end of the phone. This is the Nerve Center.
Good morning. Thank you for CONNECTICUT, Connecticut.
It's where 45 newly trained employees are already taking calls from people about the new health care law.
This is a tough process that people are going to go through. It's certainly not like making an airline reservation.
But Access Health Connecticut is trying to make it easy. The group is in charge of running the state health exchange, where people can go to sign up for a variety of insurance plans, some at subsidized rates. 2 weeks ago, the call center went live. Right now, they're just fielding questions. On Monday, they received 112 calls, each person staying on for an average of 7 to 8 minutes.
The big questions, of course, are, can I afford it? How much is this going to cost? Are my doctors covered?
Starting October 1st, these operators will begin signing people up, and yes, troubleshooting.
How many weeks of training?
2.5 weeks of training.
These new employees recently completed that training course, learning about tax laws and health plans.
They come in here and we give them an overview of the Affordable Care Act. Then we start to go into the unique pieces of Connecticut. And then from there, we start to run different scenarios.
And they will run through every scenario they can think of, so that when the real problems crop up, they'll be ready.
What we try to do is give people as many opportunities as possible to touch the information.
And all call center employees here in Hartford speak both English and Spanish. There's also a call center in Manhattan. There's about 30 employees there, and they speak a number of languages. Right now, the biggest challenge that remains is just getting the word out there about the new law. For now, we're live in Hartford. I'm Jeff Saperstone, NBC Connecticut News.
NBC Connecticut is making sure you're connected to all the upcoming health care insurance changes. You can start signing up for the insurance next Tuesday at some stores. Signs are being posted outside of those stores where you can sign up for Access Health. The first one will open in New Britain the second week of October. The second store will open in New Haven.
We're very excited. The storefront graphics in New Britain are already up. So on Main Street there, you can see Access Health CT. And we're the only state in the country doing this.
The storefronts will open year-round, not just during that open enrollment period. Ahead in 5 minutes, surprising new numbers from a Yukon poll showing just how many Americans support the health care change.
New at 5:30, we have learned Connecticut officials recently met with team leaders of the Maryland Health Exchange because they want to adopt our health insurance enrollment system. David Collins from our Baltimore sister station has the story.
1, 2, 3.
We are ready. We are open. We are actually signing people up.
At Connecticut's official health insurance marketplace,
enrollment into Access Health Connecticut. The Connecticut Health Insurance website is so successful, they're setting up a consulting business to help other states build one just like it.
We've made progress by
degrees. This is in stark contrast to the October rollout of the Maryland Health Benefit Exchange.
It is a debacle. It was a mess.
11 News has learned that Maryland officials recently invited team leaders from Connecticut to discuss their system. The Sun paper is reporting that Maryland plans to adopt the Connecticut model. Connecticut's leadership team disclosed how the no wrong door concept works. People seeking coverage should only need to complete one application to learn which programs they and their family members may enroll in. Maryland Health Exchange officials inquired about technical support needed to run the system, and questions about Medicaid determinations came up. Connecticut officials also made recommendations which they would not detail. Maryland's exchange is working so poorly, the General Assembly created a joint oversight committee to keep tabs on progress. Maryland Health Connection leaders have repeatedly said there are 5 options on the table, including joining a consortium, but have not publicly named a preference. They have outlined factors to consider in going forward. David Collins, NBC Connecticut News.
New information now about the number of people enrolled in Obamacare. The president says enough have signed up to make the law work. He told the medical website WebMD that 4.2 million people enrolled for this year, and that makes him believe the program will remain stable. He says the combination of the types of people who sign up is more important than that overall number, that more young, healthy people need to enroll to offset the cost of caring for older, less healthy patients. You have until March 31st to enroll to get coverage for this year and to be eligible for any subsidies.
The deadline to sign up for Obamacare is fast approaching. It is midnight this Monday, March 31st. And while there is still a push to get people covered, here in Connecticut, the number of people who have enrolled has exceeded expectations. It's a busy weekend at this Access Health CT Enrollment Center in New Britain, filled with people waiting until the final weekend to choose a health plan.
I think I put off coming just because I didn't know how easy it would be, but found everyone here extremely helpful and actually found a plan that I can afford. Janice Evans is now among the nearly 180,000 people in Connecticut who have signed up for health care through the Affordable Care Act. It's far more enrollees than the CEO of Access Health CT was expecting.
We're creating a culture of health insurance coverage in our state. It will never be the same.
Cunahan says the uninsured rate in Connecticut is now below 8%, and he expects that number to continue to go down. At Middletown's Community Health Center, they toasted to what's being called a successful sign-up period. Wesleyan students who canvassed the city for enrollees joined in the celebration.
The more people we sign up, the more healthy people there are in the exchanges, and the more likely that the system as a whole won't collapse. And it's really important, I think, that this will sustain itself for its first year.
Poll numbers show a majority of Americans remain skeptical when it comes to Obamacare and if the final numbers will make it sustainable. But for Janice Evans, who just got covered,
I am incredibly relieved.
There are a lot of enrollment fairs this weekend. To find the one closest to you, go to our website, NBCConnecticut.com, and just search healthcare.
People along the shoreline now have a place to go to sign up for health insurance. An Access Health Connecticut store officially opened in downtown New Haven today. Bureau reporter Amanda Rouse joins us live at our New Haven studios with what you need to know. Amanda.
Well, Keisha, this is just one more way that people in Connecticut can sign up for those health insurance plans that go into effect on January 1st.
Cheryl Foote from Wallingford came to the Access Health Connecticut store in New Haven to figure out what the best insurance plan would be for her and her daughter. She says she went to the informational meetings and logged onto the website, but still had questions about the different plans.
They don't really bring up doctors that I use. And another thing is my daughter is in college out of state, so I wanted to come down and speak with someone face-to-face.
Tom Hudson from Hamden came to sign up as well.
Got the letter that my insurance has been discontinued, so I went ahead and, I need to do something, so I came down here.
Access Health Connecticut says in the past 3 days, it's signed up more people than it has in the past few weeks, and it expects the surge of enrollments to continue till the new December 23rd deadline. Right now, there are more than 35,000 people signed up of the more than 300,000 uninsured in the state.
And I really think that we're going to make good progress this year.
And even more progress with a brand new store in New Haven. Today, Congresswoman Rosa DeLauro and State Senator Chris Murphy attended the grand opening and touted the benefits of the Affordable Care Act. However, the problems with signing up on the federal level has had an effect on the people signing up in Connecticut.
We get confused phone calls every day. Gee, I understand your site just reopened, or are all the bugs worked out? Connecticut has been the only state whose state exchange site has never been down.
And so far, Connecticut has been one of the most successful states in signing people up for their health insurance plans. The Access Health Connecticut also says that it is starting a new marketing campaign today. It will showcase real people signing up and what they were able to save by signing up for these health plans. Live at our New Haven studios, Amanda Rouse, NBC Connecticut News. Lisa, Keisha.
Thanks, Amanda.